Sreedharan, who practices in southern India, Tamil Nadu, Trichy. Personally, I know him in the WhatsApp group of discussions. He discusses a lot about the instruments. That is the reason why, taking his knowledge into consideration and unbiased nature, we considered him as the speaker. He graduated MCH Urology from Sreedharan Chandra Medical College in 2008. Underwent training in laparoscopic urology from Dr. George P. Abraham, consultant urologist at Sri Paduka Specialty Hospital, Trichy. Have been an operating faculty in RIRS in several live operative workshops across the country. Founder member of Trichy Uro Education Foundation, through which live operative hands-on workshop of RIRS and supine PCNL were being conducted since 2014, from which I have also learned supine PCNL. Chief instructor in True Endourology Fellowship Program. With this introduction, I thank one more important point in this webinar is there is no PowerPoint presentation. We are discussing every minor detail. Both of us will contribute with our experience. I have modulated the questions. Accordingly, we will discuss. Dr. Vikram, good evening.
Good evening, sir. Thanks for this opportunity to share our views. And as you said, this is going to be an unbiased discussion. And this may not be taken as a recommendation, but it's definitely worth doing some research before putting hard-earned money into the instruments.
Yes. So my first question, Vikram, when the MCH or DNB student passes out, when he is using his own money, do you recommend to buy lower tract only, or they should take the upper tract simultaneously? If they have money crunch, they are not rich, they have to take the loan. So ureteroscopy and TURP instruments are sufficient, or package, if you take all the three, will there be any advantage? First question.
So in my opinion, now when somebody is graduating and decided to become an endourologist and starting their practice, it is always, I would suggest to buy lower tract, upper tract and camera system.
Yes. Second question, coming to the ureteroscopy and lithotripsy, I know there are three ureteroscopes. One is 8 by 9.5, 6 by 7.5, 4 by 6.5 in rigid ureteroscopy. If we have to buy one, which is better, Vikram? Which size is better?
7.5 is the go-to ureteroscope for a day-to-day practice.
Does it allow pneumatic lithotripsy?
It does allow pneumatic lithotripsy, basketing, laser, as well as guide wire. Everything can be done with single instrument.
Okay. A rough cost will be how much rigid ureteroscopy? Maybe it may vary.
Varies about 2.5 lakhs.
We used to buy at 1.9 lakhs. Some companies have made up to 3 also. So 2.5 also is coming. Which company is standard in India people buy?
Carl stores.
Carl stores. And I use Wolf. This is the no conflicts of interest, because in Wolf 6 by 7.5, 3.5 French stent I pass directly in the ureter, so that CM usage will be less. That is my favorite this thing. So does any stent goes through the Starge and Wolf Olympus scopes?
Carl Store 6.7.5 also shares the same working channel as a Wolf, sir.
Okay. Does Olympus also share, or we don't? I don't have idea about the Olympus.
I don't use Olympus, but in general, I don't use ureteroscope to stent.
Yeah, I use it, so that's why I use ureteroscope Wolf. So in general, which company is giving all the three in a package at a lower cost? General cost may not be the requirement. Is it Coral Starch again?
It's going to be Carl Stores, but Olympus also is trying to give as a package for the freshly coming out postgraduates.
See, my dear urologists, we may not have knowledge about the Wolf, but we are telling our knowledge only. You inquire and you compare the cost, you buy it. We are telling that 4 by 6 by 7.5 ureteroscope is must for any urologist to start with. And I am choosing Wolf and he is choosing Olympus. Whatever it is, around 2.5 to 3 lakhs. This you have to keep in mind. Second thing, in this, if you want to buy the pneumatic lithotripter, traditionally in India, we buy only Indian pneumatic lithotripters. Majority of the people cannot buy Swiss, whatever advanced. Do you have any idea how much average I remember Cisco, Nidhi, all these have pneumatic lithotripters. Do you have idea how much roughly they cost? Previously, it was 40,000 when we have taken.
I think around 75,000 to 90,000 is the cost. It again depends on whether we are going to buy the compressor along with that or going to use our hospital's inbuilt oxygen pressure system to create
Which
pressure.
company? Which company?
Justlin seems to be good.
Uh,
We
uh,
have a
do you think
Justlin.
that? The oxygen which is present in the cylinder, oxygen present to the central connector, oxygen given by the company, which is good? I mean, I generally connect to the oxygen by the hospital cylinder, or now after the hospital is made, I am connecting to the central connector. Even local, whatever the company gives, that is also good.
Yes, sir. It is equally good. It depends on what facilities we have because for somebody, if they are going to do a roaming practice, they may not have everything built in one roof. Another problem is the compressor will be very heavy for them to carry if they
But
have to
most of
carry.
the times in the hospitals, oxygen will be cylinder will be. I mean, any cylinder will be there. Any oxygen cylinder will be there. So I think they can use through the hospital. You need not carry in the vehicle.
Exactly.
The package wise, if you see, even Olympus has package. To my knowledge, somebody has commented S22 Ultra said that package is around 13 to 15 lakh. To my knowledge, even Coral Stars also equal package because they are competitive. Do you have anything better with this service, either with Coral Storage or the Olympus service aspects? Any difference is there? We are not conflicting. Personal experience. By chance, if you have bad service, see nowadays, even if you go to hotel, hospital, they are asking for review. We can have a review of our own. This is not an official program where we are doing as a conference. It is a webinar, sharing of the knowledge. Coral Storage people, they come regularly. I have access. Olympus also is okay, no problem. What do you think?
This is a very important aspect I would like to take this opportunity to highlight. Before all of us decide what instrument to buy on, we have to see not the cost of the equipment, but the servicing capability of that particular company.
Yes.
Because I have had very, very bad experiences with servicing of all the companies for that matter,
Yeah.
including call stores.
Yes.
So, as of now, for my equipments, I have very good comfort zone with call stores.
Comes.
So
Even I have
somebody,
one with Coral Storage. Do you think that ureteroscope, if it is broken, suddenly vision goes during the laser or pneumatic? Do you think that they will repair?
no, sir,
They won't repair.
no.
In private, some companies are repairing, but they don't repair your ureteroscopy.
They
They
don't.
give only buyback. They used to give buyback 80,000 rupees Mafi. They used to do it at. That is the only thing I think we can get. And
So,
recently we heard Shawley scope is also good. I am using the nephroscope, 13.8 French nephroscope Shawley. It is very good. I mean, now 2.5 years I am using, less costly than standard nephroscope. There is no nephroscope which is 14 French. All are 12, 15, 18, 22. 13.8 by 15 French Ampla sheath is a very good mini perk, actually speaking. One more question is asked by the Suri Reddy. 4.5 French than 6 French. Directly, if you buy 4.5 French, what is the disadvantage? Can you tell, Vikram?
sir, 4.5 French is a very flimsy instrument. The
Yeah,
chances of wear and tear is more than owning a 6 French.
yeah.
So I would recommend 4.5 French as your second ureteroscope,
Correct,
not as
correct.
the primary ureteroscope.
Correct, correct. Great. That is highly appreciated. And now 6 by 7 point by 8.4 Olympus is there. It is slightly bigger. Nowadays, what's happening? Primary URSL, if you cannot do, patients will feel bad. So better to have 6 by 7.5 is our opinion. Anything more than 8 French, it may not go. What do you say?
Agreed, sir.
Agreed. So now coming to the next question, this is about ureteroscopy. To conclude, we have predominantly 4 companies. Number 1 is Coral Star. Number 2 is Wolf. Number 2 is number 3 is Olympus. Number 4 is Shawley. Anybody can express your opinions. We are repeatedly saying we are not recommending anything. Lot of people will be asking us. Let's make as of today what is available. That is about URSL. Better to buy URSL in the beginning because it's a bread and butter surgery. Now, Chengalvarayan sir, President ASU is, I can see him. You wanted to say hello, sir, before we proceed to the next this thing, or is it okay?
Yeah, please carry on, sir. Please carry on.
Yeah, okay. Now, next question is TURP instruments. Traditionally, worldwide, TURP is done with Starge, Olympus, Wolf 24 by 26. Vikram, you are also doing enucleation. Let us discuss only about TURP. Do you think that 24 by 26 is traumatic? If you take 22 by 24, the loop is different. Is there any solution to have smaller resectoscope sheath, or better to adjust with worldwide 24 by 26 is going on, but Indian penises are small and you may have problem. What is your opinion? What size a junior should buy TURP equipment?
Sir, if they are well trained for the first few cases, they may suffer struggle in 24 intermittent drainage. Is the my
Idea.
recommendation would be a 24 French intermittent drainage.
Correct. Excellent answer. I must appreciate that, because you keep on removing, emptying the water, but it will not damage the urethra. You need not buy also. But if urethra is good, you use 26 also Iglesia system. So you need not buy both. So 26 by 24 you buy. Use 24 as the single system. That's what he's saying. Okay, that is a good answer. I'll add one information. After a long time, I have taken Wolf 24 by 22 with the same loop for 26 and 24 they have given, and it cuts reasonably good, and it is also good. This is 24 by 22 Iglesia system, but in small urethra it goes very nicely. I don't remember the cost, but it is okay. Now, what do you think? All the TURP instruments are roughly, all companies are same, or I standardly use Coral Star. In India, most of the people use Coral Star. I think they have good, no less competition. In fact, what is your opinion?
Yes, sir. One important highlight I wanted to say: whenever we buy these sheets, cystoscope sheets, or the TUR resectoscope sheets, we have to feel for the tip, the edge.
Yeah.
Because in Indian systems, you have had very bad experiences of damaging the entire urethra.
Yeah.
Either due to current leak or because it scratches through the urethra whenever we introduce or take out.
Yeah.
So in our center, we have made it mandatory that we will have only call stores for resectoscope.
At least I must say that this is the one area, for example, when you go to conferences, this is the one area where the Indian outer sheets less than 1 lakh, less than 80,000, they are not lasting long. They are rusting. Their tip breaks, and their beak also, ceramic beak also breaks, and the loop also comes inside and stucks. And loop also, current transmission is not good, and chances of burns are also will be there. So try to, unless the company is very good, we get tempted. Even I got tempted many times to buy the outer sheath, inner sheath from the local company. But remind you, these instruments will come for 10 years. What do you say, Vikram?
Yes, sir. The resectoscope we are using is for 30 years now.
Yeah. So 10, 15 years, when you are investing for 2.5 lakhs, 3 lakhs, better invest, because TURP is bread and butter surgery, cystoscopy is bread and butter surgery, TURBT is bread and butter surgery. Even OIU also will come along with this, except the inner working element. So better to buy either, most of the times, Coral Star and Wolf are two. Actually, Olympus company has optics very good, people say. They look very bright. Fantastic. But the only thing is slightly more costlier than Coral Star, I think, to my knowledge.
Olympus, if we are talking about the urologist has to take a decision which system they are going to go for, because their cystoscope, their ureteroscope, it is always advisable to buy as a package so that they can cut cost.
Yes. See,
So
yes, correct.
and
Because the
another
first question itself I asked, do you apply
exactly.
for package? If package company is good and one or two negative points are there, still we have to adjust.
Sir,
That's what
another
Farah charge is showing. Yeah.
important point is when urologist is practicing, you are doing a case, suddenly the scope's vision is lost. If you have to hurriedly buy a scope from your friend, it is always better that your neighbor also has the same make, same company, so that it is compatible, so you can get away from that case at least.
Correct, because this idea is also that we have been discussing in WhatsApp groups. Hundreds of people are there taking their feedbacks into consideration. We are talking not only that what we are. So people are responding now. Bipolar TURP has come way forward. Now in that Olympus has scored more than Coral Starch. I don't know why from beginning Olympus is better. Coral Starch claims that his bipolar is the true bipolar because true bipolar. This we are not going into this controversy. Our aim is which company gives at lower cost, which one gives service, which one works for a long time. I think some people are happy with Coral Starch bipolar also. Nothing like Olympus only, but these two are competitors. Do you agree?
Yes, sir, I agree.
With Cartry, I think they will give around 10 lakhs. This cost 10 to 12 lakhs. Bipolar.
The bipolar, no, sir. Now it has become from 12 to 14.
12 to 40. That's why every year 50,000, 20,000 it may be increased. When I have taken it was around 9 long back. Now it is I think 12 lakhs. But that you check. There is no need to discuss. Cost is not discussed here. Which one is better? Bipolar Olympus is famous. Lot of people use. Starch also will be used. So both will cost around 12 to 14. In your package, if you take, it will cost more. In the beginning, don't worry about bipolar. Monopolar, my knowledge, nobody died because of monopolar. When Iglesias system is used, be careful that sodium is done and all that theory you apply and take care of your patient. Don't prolong surgery. Now let us come to the nephroscope. This nephroscope is very important instrument. Why? Because there is a mini pair, there is ultra mini pair, PARC. So 30 French is there, 24 French is there, 18 French is there, 12 French also some people say best ideal. What is your opinion, Vikram? Which size you will buy if you have passed yesterday MCH?
Sir, again, here it is the discretion of the urologist and the place where they practice. In the place that I practice, we hardly get large, hard stag-on stones, which I used to see when I was with George P. Sir.
Okay.
If the urologist where he is practicing is going to get all those large stag-on stones, it's always better they go for a standard perk.
That means up to 24 you want to go, 26 nephroscope.
No, not the 26 nephroscope, but at least the 19 French nephroscope would be more ideal.
People say Dredson is one of the best scope in Wolf. Lot of people say. I have
lots
not
of
used I
lots
use
of positive reviews.
Positive reviewers. I use Starge. Olympus is also nephroscope is very good. All the three companies. Any Indian nephroscopes? Do you think I never heard? Do you think?
But the digital ones, yes, not the conventional ones.
Yes. Now digital one is coming. We'll come that now. So if I have to buy, I will buy 18, 19 or maximum 22. These two I will prefer because 22 by 24 ampla sheath can remove all these stones, staghorn as well as small stones. It will be in between. But if you wanted to take, I already mentioned Shawley 13.8, my favorite scope for RAR is failed inferior calycial stone. 12 French Starge is good, but somehow laser can be used, but pneumatic, if you put water, doesn't go. A lot of people use 12 French for laser. If you do lasing in PCNL, you don't feel so good. If you dust again in PCNL, why should you do PCNL? What do you say? Some fragment should be removed in PCNL. What do you say?
Sir, I use a MIP, the 12 French Karl stores with their metallic amplas is what we routinely use.
Yeah.
And it has crossed several thousand of cases without any problem.
There are crazy fans of that scope. The people like Dredson and Ultra, the Starge Mini, these two are very crazy nephroscopes. I think Wolf Dredson and Starge 12 French are very viable. Otherwise, 20 French are 18.5.
24 is also good. 24 is very sturdy scope.
24 nephroscope is dangerous because nowadays we cannot tell that. because 24 if you put bleeding will happen. 30 by 24, however good you do, parenchyma will be damaged. We are slowly moving towards era of 22, less than 22. In fact, mini-perk definition is less than 22. Maybe 15 to 22 is ideal for a single this thing. Some of the questions we have to take. The Prakash has asked, monopolar cutting between 10 o'clock and 2 o'clock sometimes is difficult with local loops. We are not recommending local loops. I have seen burns, and loop also burn very fast. So we have to keep in this in mind. So we have to see about that. Other is the digital scopes. Now,
One thing, when we are talking about the loop, there are two things there. One is that Unitex loop is fantastic.
Unitech.
Unitex loop is
But
fantastic.
does it fit into the normal coral star?
Yeah, it is fitting. They have both the single stem as well as the double stem. But what we ultimately did, we moved over to Karl Storz loops, original Karl Storz loops. It mates fantastically with Valley Lab diathermy, lasts longer and longer and longer.
But again, Valley Lab diathermy is costly. I have taken recently. For 15 years, I have taken Allen only. We will come to that. Now, we have in exactly 24 minutes, we have made a summary of the nephroscope, ureteroscope, and the TURP instruments. All together, without bipolar, may cost around 15 lakhs. So, in the beginning, we will recommend this. Not only in the beginning, even if you have one hospital, you can keep this instrument and then think about other scopes. What do you agree? Can we close this as lower tract before we go to the
cystoscope? Standard cystoscope, what they have to buy.
Yeah, okay. Standard cystoscope, again, we are thinking about same because TURP 0.4 French, this telescope only will fit. So whichever company you buy, they give only that company fitting. So you are taking starch, means better to take an all star. Even light card is a problem. If you take from different companies, light card will not fit. You have to take connector. So better to buy as a package for the beginner. Do you say?
Yes.
What do you say? Cystoscope, which company?
I recommend a 20 French standard cystoscope from Karl Storz.
Okay. Now let us move, because we cannot cover all the things. Let us move to the camera system. See, all the questions we will take as of now, because it is rolling up. I cannot roll down. Finances, they ask. See, when I came, I have taken only URSL and TURP. That after 6 months, I have taken nephroscope. See, 15 lakhs if you wanted to take loan, how much per month we have to pay? For example, there is one company, what company? Siemens will give loan for the juniors, degree based, not property based. They give without interest, 3 years they divide. That is very good. I have taken that thulium fiber laser. So, do you think that 15 lakhs you should take loan initially is better, even if you are not earning lot? For example, everybody can earn 50,000 to 1 lakh in the beginning. Even if you join with other urologists, they will give 1.5 lakhs, 2 lakhs. Can they buy with the loan, this lower tract, upper tract?
100% they have to have their own instruments.
Yes, they should have their own. So they are saying, somebody is saying that 32,000 rupees per month will come. That I think anybody can buy it. So let us close this financial system there. If you want to buy laser, everything, then financial system will change. That is a big loan. We are talking about juniors related matter, where initial 15 lakhs out they have to buy when they don't have money. See, if somebody has money, father-in-law is giving, namaste. So there is no problem. You buy whatever you want. But if you don't have money, you can't ask parents, and then you wanted to plan, then 15 lakhs loan you take from any company. Now coming to the camera system. See, this is a tricky. Day by day, we are moved to single chip. People say nothing will be seen in that RIRS. Then we move to the 3 chip. Then we move to the HD. Now, after the robo is taken, I am thinking HD with 4K, and it is crores money. So what do you think in the present system? There is one more problem, Vikram, before you answer. Everything is moving towards digital. See, practically we have to talk now. This is a tough question I am asking you. When you buy lower tract everything, you have to buy one camera. As of now, if you are post MCH, which camera you buy? Forget about digital. because everybody digital is still coming up. Next year talk may be changing. What camera you will buy? Single chip or 3 chip?
Single chip telecam call stores.
Yeah. So
Cheap and best.
we also have done that. With this, you can do URSL, you can do RIRS also, you can do TURP also, you can do nephroscopy also. So if you don't have a problem, single chip, somebody is telling that Olympus is, somebody is helping us. iPhone to everyone, he is telling, I don't know name is, if he writes his name, we can mention. He says that Olympus is 14 lakhs, but Olympus camera is also good. This Starge, when we have taken it, is 5 lakhs single chip. Now, how much it is, Vikram? Now, roughly?
Now telecam is not available.
No, telecam not available now. That is the
But
problem.
there are so many Indian companies, so many companies are marketing their own brands. Seems to be very reasonable with their pricing.
How much? 6-7 lakhs?
6-7 max 6-7.
Max. Any company you say, Indian company, which is good?
No idea, sir. I have not used.
I have also not used. Prashant is telling that Olympus single chip is best, 2.5 lakhs. See, these messages are very important. You note down, even when we discuss in Euro Mentorium, I also note down, I have purchased my Siam like that only after discussing with Euro Mentorium. They will be useful. This is a knowledge sharing. There is nothing wrong. Ultimately, our society should get benefit. Nobody will give uniform cost. Nobody will give if it is damaged. Nobody give insurance. It is our headache to inquire. Then why not? And now ESI CAM, somebody is saying 3.5 lakh. Single chip is good. Everybody is saying single chip is good. For all the juniors, single chip you take. Once you go to higher level, Vikram, what do you recommend? You recommend 3D? 3 chip.
Yeah, 3 chip HD is the way to go. Ultimately, if somebody is planning to do laparoscopic work.
Yes. I also feel strongly.
Sir, recently in Chennai workshop, Tamil Nadu Tapasu workshop,
Yeah.
I saw one camera, well-necked camera, which is a HD system. It was fantastic. I was really happy to see such a camera system existing. I asked for the pricing. He said the camera, monitor, and the light source together will come around somewhere 10 lakhs.
Reasonable.
The quality was equal nearly to image 1S what I have.
Very good.
Somewhere it was very close.
Indian made?
No, sir. I don't know what make it is. It is
Well,
a well next.
It was having a stall or live transmission was there?
Dr. Dheeraj was doing the enucleation work in the workshop. He used that camera.
Okay. UMD nephroscope 19 French optic fiber is there. That we will come. We'll not jump. Now coming to the camera. So to conclude, if you wanted to do lower tract and endourology only without lab, single chip is okay for beginner. Once you attain certain stage and earn money, you can go to the 3 chip camera. But advanced systems like 4K 20 lakhs above, you will get good systems. But 4K and all are 40 lakhs above. Not really.
Another via media option is to buy second-hand camera units. If somebody is game for that, before we really invest into a HD 20 lakhs, 25 lakhs, I did that from single chip. I went to a second-hand HD camera system. And then once I was so happy with that system, then I matured into a brand new one.
In this second hand also, you remember, if the vendor who is supplying is able to repair, it's okay. Bio-rad person sometimes gives, he answers. If the moment he doesn't answer, you are in trouble. If he says that, sir, we cannot repair, your 10 lakhs gone, and next instrument you have to buy 15-20 lakhs. So be careful about refurbished instruments. We don't recommend, at least in these forums, to go for that. It is your personal risk. URS Shali cost around 3 lakhs. I also remember around all the URSL now has come around 3 lakhs and they are good. Now coming to the, this is about the, this thing. So exactly half an hour we finished the lower tract camera systems. Now coming to the flexible ureteroscope, which has become part and parcel. We both are reasonably knowledgeable, so we can share openly. Now we have used FlexX2 5 lakhs. We have used P7 5 lakhs. Used to come for 100 cases, मान के जाओ. Roughly 100 cases, if you use 5 lakhs, how much it will come? 20,000 per case it will, or 2,000 or 2,000 per case will come. Now presently, the digital has come, everybody is using digital. What is your favorite flexible scope in digital now, as of now?
As of today, my favorite is the VisiMed, which is the reusable digital.
It is around 2 lakhs, na?
It is about 2.5, I guess.
2.5. But it comes as if like a reusable, official reusable, that is.
Yes.
And edge, the backside disconnect, you can disconnect, na?
Yes.
Yes.
The biggest advantage, the difference that I have noticed, I've used Biorad, the Huge Med, and this. If I have to compare head on head, Biorad lasts longer. It is a very sturdy scope, but
Action.
the 20th case, the 30th case, that flexion becomes tough. It
Stiff,
puts a
stiff.
big strain in our thumb.
And inferior calyx, it doesn't reach also.
And the moment we take our finger, it will come back to its normalcy.
So continuously you have to press.
So it hurts the fingers.
It
Whereas
hurts the
in
finger.
Huge Med, the lever becomes more lax. We will press it fully, but the scope will not bend fully. That I'm talking 10th case, 20th case, like that.
Yes, yes.
The current VisiMed that I am using, this is crossed some, I think, 100 cases now.
Very good.
Fully bent, fully deflectable, no strain on the thumb. I was really surprised at its dexterity.
I think they have written 1.75 lakhs by Shantaji. We also have to bargain. Maybe we have given more. I have also taken VisiMed. We have used a lot of cases. I have recently purchased. He has given quotation. I don't remember. But I strongly feel. But my favorite scope is HughesMed. It is pediatric because it is very small. 6.3 French also has come. And HughesMed vision is also very good. Very, very good. Color is that pink red color I like. If it is yellow, I don't like. But it is personal. So 3 ureteroscopes we are quoting here. Number 1 is Biorad, which is durable, but flexion is a problem. Number 2 is VisiMed, reusable scope, 2.2 lakhs. There is no problem. Number 3 is HughesMed, where for very small ureters is very good. Other lot of future made, everybody is coming. Nowadays, every company is coming. You discuss and buy. Take care that 2 things, infection should not be there, and proper sterilization should be done with chemical sterilization. Now the question, it is a very important question, Vikram. Now, nephroscope, ureteroscope, cystoscope, flexible nephroscope, flexible ureteroscope, all are coming digital by Biorad, and only one monitor 2.75 lakhs. Then for a beginner, why should they buy all this Olympus, Carl Stage, camera? This all will come, you know how much cost? Less than 10 lakh it may come in package.
That too digital with a recorder.
With a recorder. It may be a game changer in the coming 2 years.
100% I accept that, sir.
Yeah, this is what we have to think. If you have a guts, anybody who is there, try this monitor which can provide all these scopes. Now they have come with cystoscope and they are very light, ergonomically very useful. Even imagine digital cystoscope is there and TURP you are doing, vision will be better now. See, almost like FlexXC vision we are getting today with Biorad and HughesMed. Do you agree or not? I purchased FlexXC for 14 lakhs. I used to keep for only academic ectopic kidney. Remove and take. That has gone now. And they said that 10 lakhs you pay for repair. Then I said it is into the dustbin. I mean, just naam ke vaste showcase. So, dear friends, you also keep your mind about the digital scopes. Digital scopes may directly connect with the monitor, which is only 2.5 lakh. They may give monitor free also if you take all the scopes. What do you say? Ureteroscope,
we have to bargain. Yes,
bargain.
One can bargain like that.
Scopes, they are giving one monitor free to my knowledge. 5 flexible scopes is worth how much it is? 2.2 lakhs, 3 lakhs it will come, I think. Our monitor cost may be lesser. So as of now, I have not replaced the entire system with rigid, but it may happen. But let us conclude here. Flexible scope, digital is better. 3-4 companies are better, cost effective to do on the patient, and that's where we will close the discussion now. So we have taken 37 minutes where we finished the lower tract, we finished the camera system, we finished the flexible scope system. Now let's come to the lasers. What do we do with the lasers? Now, this is a common question asked everywhere. Sir, if you wanted to do stone, what will you take, sir? TFL 30 watts or holmium laser 30 watts. What is your answer?
I will again counter question. Is the urologist going to stay put in one hospital and practice, or is he going to have his practice in 3-4 centers?
The answer is obvious. If
Exactly.
you are a freelancer, you cannot buy holmium.
My comfort level is always with holmium. To the ureter, some may or may not agree, but I have always found it I am more comfortable using holmium in the ureter rather than using TFL in the ureter.
But the biggest problem is ureteroscopy is also important. RIR is also important. So for RIRS for 10 years, I have used holmium. Now I have kept aside holmium and using only TFL. But my ureteroscopic TFL, we do very low. We repeatedly talk carefully as if I am going to damage. As if I am going to damage. I'm not saying that. I'm experienced. As if I'm afraid of ureteroscopy than RIRS.
True, sir.
I'm afraid of ureters because ureteroscopy flow is only unilateral. Water will go up and it doesn't come out. Ureteroscope blocks the ureter. Whereas at least RIRS, you have access sheet, something XYZ. So, or suction or whatever, we don't know. So now this question cannot give answer then. We both cannot give answer. What is the cost difference between TFL and 30 watts and holmium 30 watts?
Not much, sir. Somewhere
2 lakhs.
around 23 to 25 lakhs would be more or less the price. Because in TFL, we also have to buy the carrying case. So that they charge 50.
Some people like Vamsi says that enucleation also can be done. Honestly, I have started enucleation only after TFL. That means you have scope for one more surgery. So I personally get biased with 35 watts TFL. You can do enucleation, you can do bladder tumor en bloc, you can do URSL carefully, RIRS too, you can do very well. So I will give 60% of marks to TFL 35 watts. If only laser stone has to be used, only stone, I will give 60 marks to TFL, whichever company. How many marks you will give for these?
I would give 60 to holmium.
Holmium, 60 to holmium. So this debate will never end. If we have not concluded, means it is your choice. Whatever you want to buy, you buy. And second thing, if you are a freelancer,
definitely TFL.
So we cannot buy the
holmium
because the glass shields will go. And what is your opinion? Holmium blast sheet goes every 6 months to me. 70,000 I used to pay. No, for you?
No, sir. Last 10 years, only once I had to replace blast shield.
Somehow I had a bitter experience. Many people say it is. Vivek Singh is asking enucleation with 35. Very well, it can be done, Vivek. थोड़ा स्लो कर सकते हैं, थोड़ा पूरा.
No, sir. It is proven beyond doubt.
It is proven beyond doubt that you can do enucleation.
It is the technique rather than the energy source.
Rather than energy source. It's a technique which is, some people use mechanical, some people slowly. Maximum it takes another 15 minutes. But bloodless field you can do it. Bloodless field you can do it. So to conclude, dear friends, if you want to use as a freelancer, buy TFL. If you want to use your own hospital, don't move. Buy holmium or TFL. Vikram says holmium is good for both and safe for ureter. I say that TFL is also safe, but be careful in the ureter because it's a coagulative nature. Let us close this discussion. Now coming to the
another point is TFL is more or less a maintenance-free mission.
Yeah. That's what I'm telling. By any means, I have not spent single rupee on TFL.
Whereas holmium will have recurring expenses in the form of AMCs. TFL, especially the IPG people, don't insist having AMC.
Yeah, AMC, CMC. Correct. Very important point you told. Even though I don't have AMC, CMC.
Whoever buys laser, please buy a online UPS. Without online UPS, please don't use laser. I have seen several situations where the laser machine got spoiled because of voltage fluctuations.
We will come to that. I will also mention about the UPS. Now let us go faster because we have 18 minutes time. In that 18 minutes we have to finish because I am very particular about time. By exactly 7:30 we have to close. We are not here to tell the entire world knowledge to anybody. Now this is the conclusion. Now, if you want to do enucleation, 100 watts holmium versus 60 watts thulium fiber laser.
60 watt TFL.
60 watts thulium fiber laser, I vote for it because 100 watts is very costly. 1 crore CMC is costly. Oh my God, very few people passionate and great about like Tanush Pal Bhatia, Pankaj Maheshwari. These people are known for it, so they are doing it. But I am doing comfortably with TFL 65 watts, which is around 35, 40, 50 lakhs, 45 lakhs like that.
40.
Now let us close the lasers. That is all about laser. There is nothing much to ask. Now, small accessories we will discuss very fast. Number one, CM. How much in a hospital owner should spend? 12 lakhs or 20 lakhs? Which one? Which 12 lakhs? Which machine is better?
For me, I use Meditronics, which is owned by Philips now. Alangers is also equally good.
One Ahmedabad company I have taken, Precision or something, it is doing well for me. But Alanger 18 lakhs one is also very good. That whereas a flat people.
But again, it's the servicing, sir.
Yeah, servicing. Alanger gives okay. Alanger Ohmium laser did not pick up in India very well. Some negative feedback. For example, Wolf also have negative feedback. They use refurbished. They don't even people like Subnis are also mentioned that be careful. Somehow they are not able to come out of that Wolf ureteroscope person. Unfortunately, I am buying Wolf ureteroscope only. But be careful. Talk to terms and condition whether they can repair or not. So as far as the CM is concerned, Medtronics, Alanger, once upon a time Siemens was there. Now it is not coming. They have gone 20 lakhs above. So worth putting 12 to 14 lakhs.
Kiran is also good. Something to consider.
Kiran, I was telling. Kiran, I have. Kiran and one more Ahmedabad company is there. And one more thing, during RIRS, CM usage is very less. So you should not be too much crazy about it. All the missions will give good image. So unless orthopedics is also doing. Digital CM Alanger, somebody is saying 16 lakhs now, not 18 to 20. That is a good. So 16 lakhs you can buy. Recently, Ashavardhan I have seen, he has taken that. Adinos CM, I also don't know. Do you know anything about Adinos?
No.
Don't know. Somebody is asking which is the most feasible bipolar cartridge for TURP. Anything BOVA or less costly. See, bipolar, I am using Olympus as Allen cartridge. Allen, I am very comfortable with cartridge. What are the other cartridges, Vikram, in the India possible?
For bipolar, sir.
Bipolar, monopolar, everything. Now recently I have taken Ligashur company for robotic. Oh, extraordinary monopolar, yaar. My God. It is
that is Covidian, sir. Same Valley Lab.
Valley Lab.
It is the same
Valley Lab is extraordinary.
Fantastic.
My God, when I do robotic, the coagulation cuts without any damage.
Lateral spreads will be very less.
Very, very less. Good company, cartridge if you have money. But initially, people cannot buy. Allen is very good. Olympus I have taken slightly less effective. What are you using other than Valley
Lab? I have only Valley Lab, sir.
But Valley Lab advantage is 10 years, 15 years you can use.
Again, no AMC.
Rugged model.
Rugged.
No
very
AMC,
rugged.
no CMC. You can use for any number of time. Somebody saying G is superb, bit expensive, but surgeon monitor and ARC are in same unit. G. About the CM, I think. Shalya is good for bipolar. Yeah, Shalya is also good. Lot of people told Shalya is very good in our Euro Mentorium discussion. Herb is also very good. So cartridge is your choice. Herb is there. Shalya is there. Allen is there. So depending on your service again, isn't it? Lot of people are telling Shalya. So we should take that point into consideration in the view box. Now let us close the cartridge system. Now coming to the UPS and generator. What are the things which can run on UPS? You tell me.
Except CM, everything else needs
everything runs. How much UPS you have to take? 7.5 kV?
7.5 kVA should be
7.5 kV costs how much roughly? 20,000? 50,000?
No, sir. I think around 50,000 with batteries
50,000.
and all.
I think 50 to 75,000. I have forgotten.
Yes.
So that is must.
But again, once you buy, it will just keep lasting for several years.
The batteries will come for 4 or 5 years. Only thing what is important for the audience, I am telling, current when it goes, no problem. Current when it comes,
back.
Current when it comes, for example, for somebody says that if current goes, I will switch off everything. But sometimes Indian current may come within 1 second. Then you cannot switch off before that. By the time damage is done, advertisement is there, the tubelight will burst like this. So better current when it is coming, it should come through the UPS. It should not come directly from the plug box. That is very, very important. generator
For lab and our equipments, online UPS is a must.
Because these are costly equipment, especially these cameras, 30 lakhs, 25 lakhs, their monitors may go, even cartridge may go, even bipolar, everything may go because the chips will be there. They will get burnt. Those chips are costly. That is what we have to remember. So now coming to the last 12 minutes, we have time. Coming to the Endourology, we are not including laparoscopy. There is nothing great in laparoscopy. All the instruments you can buy local persons. Cameras, endoscope you can buy from the Coral Stars or Olympus. 30 degree, 0 degree, 30 degree, 10 French is better. 5 French also can be taken. There is nothing much in lab to discuss. What do you say? Because
nothing much.
Maryland is there, suction is there, everybody will sell.
Indian instruments have been fine-tuned and better now, except for those hemolock applicators, which has to be original from VEC.
Yes.
All other things, I think Indian ones are good.
It will cost around 80,000 to 90,000 or 1 lakh. 10,000 difference, better to go for this thing. Somebody is asking the CREP 2 helix for bladder wash to save time. Helix evacuation, that two types, one bag type, one bottle type will come. Anything interesting in helix evacuator? Nothing, na?
Nothing, sir.
Nothing. Helix evacuator, you can buy whatever you want. It is not very costly.
Now even syringes have come, plastic syringes, which have a lower lock to adapt.
Yeah, very easily to adapt, especially one with vertical, another is ball type. Vertical I enjoy because water will come out easily and the gas will be on the top and it will not go back again. Whereas squeezing type, ball type will come, it is... somebody is telling scan C-arm is also okay.
That was L&T, sir. Name change taken over by Scan Ray, which is also apparently good. I have not used it, but it seems to be good.
Yeah, I have not used. Lot of people are taking Allenger. If it is 16 lakhs, I think Allenger is worth because it is also 10 years game. Now coming to the uroflowmetry, somebody has asked. Uroflowmetry, urodynamics, quickly one comment, Vikram. I used Cisco for a long time. Now I am using MMS for 10 years. It is working because urodynamics I am using. So MMS. What are the other companies? Do you have any idea?
Plenty of companies. One new company has come out with a wireless model, which is also fantastic.
Yeah. I heard. You just pass urine. You need not have wires and all. Print will come.
Exactly.
Yeah. So
I use Status. That is what
I use Status.
I would say. In fact, Euroflow is the first mission to get break even for any urologist.
Circumcision also. Circumcision and uroflowmetry are high initial saving for you. There is nothing like see, don't think that we are charging more to patient. We are using our 12 years of brain. There is nothing wrong. We interpret uroflowmetry. We do circumcision well. So that gives few bucks of money with which we build up our practice. There is nothing shameful or laughing here. You can go ahead. Anyway, Allen cartridge, various types are there. Best cartridge is 7 lakhs and 4 lakhs to 5 lakhs also will come. And 10 lakhs if you keep top class cartridge also will come. Usually 5 to 8 lakhs you can keep. Ultrasound missions, I think we cannot comment today. We will leave it because generally GE and GE. And second thing is Samsung. These two are good. If you want to go for biopsy, only as of now, BK is the only ultrasound. So
BK has been taken over by GE now.
Sonocyte and all this ultrasound I have taken, but not cost effective. It's better to buy. I enjoyed Samsung and GE. Best TFL laser they are telling. Intercardio I enjoyed as of now. No conflicts of interest. Quanta is
IPG. IPG is my pick.
IPG is also my pick, especially in South India. These people are giving good response. There are no conflicts of interest in that. Whatever you buy, no problem. Homium company of choice for 35 watts is cheapest Allenger, but lot of companies have come. Quanta we recommend.
recommend.
Because time constraint, we are going quickly. Don't take that we own Quanta or we don't. There is no question. Whatever we have used all the equipment, whatever our experience, I am 20 years, he is 15 years. We are telling with our experience, Quanta I used 10 years. Now I am not using Quanta at all, but still I am telling Quanta, I am using TFL, IPG. So things will be changing. To next year, this discussion may not be worth. Everything may change. As of today only, it is like that. Somebody, anything, sterilization, somebody is asking. There are only two sterilizations, not much discussion. Chemical sterilization, ETO, and steroid. So in the initial practice, everybody uses chemical sterilization only.
Sidex. Cost effective.
I
Ease of use.
use a Paracef. Both are okay. Why I use Paracef is it is daily, it can change. Sidex, the color will be changing. It becomes muddy. I get doubt whether it is useful or not. But a lot of people are using Sidex. Whenever Paracef fails, I will use Sidex. So we have 7 more minutes time. Anybody wants to quickly answer, help the audience. Anybody quickly want to comment? Okay. How to start store the instruments for transport? See, transport, lot of companies are producing boxes, beautiful boxes like
Endosys.
Endosys, huh? Endosys is good.
That box is good. That box is sturdy.
South Indian or North Indian or which? We don't know.
Don't know where they are based.
Cost is 10 to 20,000 only each box.
In fact, the same company has a Sterat like plasma sterilizer also.
Endosys. Oh, very good. I didn't know this. Very good information. I am not carrying boxes. I don't think I will carry anymore. That's why previously formalin also I used to take formalin bags. But Sidex is a god chemical for the urologists that we all do for this thing. Endosys is Chennai based. Ankush Puri has kept. Thank you, Ankush. Endosys is Chennai based. Great product. We will look into it. This is important information for the audience. Even I didn't know that. Lab go for Wolf instrument 1 by 1. Lab. No, Star is also good. There is no problem. Even Olympus lab is also very good. Otis and stone punch. Are we still using stone punch and Otis? Otis we use. Carl Starch only I use Otis. Any other?
Those are all once in a lifetime we'll buy.
Once in a lifetime instruments, better to buy the Carl Starch. Please mention about Marcelator. What is the Vikram? You use 22 French mini enucleation from the company EZ. RZ. Always I confuse EZ. RZ. Roughly cost of 10 lakhs na altogether.
Marcelator costs somewhere around 10 to 12 lakhs, sir. 22
French. You are using?
I am using Tomy Biorad, but FutureMed has come out with a Marcelator which is equivalent to Tomy. And
what is the cost of that?
Somewhere around 10 to 12 lakhs should be the
I have
cost.
taken 10 to 12 lakhs Starch. I am enjoying, no problem. As of now, no trouble with enucleation. So Starch is there. Wolf Piranha is costly but standard.
20 lakhs.
20 lakhs. And what you said is which company? Biorad. Tomy Biorad. That is
FutureMed also is good. FutureMed is also good.
FutureMed is also good. So 4 companies we are telling. Regarding Digestant, 150 rupees, whichever company you take it. Sometimes infection comes, I will change the company. Then I think that infections have come down. These are all big. Sometimes I put all digestants in Paracef and then wash and use. Because 150 rupees is too cheap. Cook company always asks for 750 rupees, use sir. But 1K 700 rupees we cannot lose. Do you agree or not?
Indian based ones are good enough, sir. Yeah.
Sheets, surgical drapes, I use kapada wala only. Now I don't use disposable. Ideally, this forum is not the forum. If any HIV positive or lost patient there, then reusable I will use. But lot of any company you know about the disposable drapes, very good company.
Lots of local marketing, sir. Lots of people. We have in Trichy itself, they are manufacturing.
Actually, those who I wanted to conduct a webinar for the government schemes. What is the equipment which comes at low cost? Because we cannot do anything now. But today it is not our purview. We have only 4 minutes time. Math Surgical Bangalore, somebody is saying urodynamic or I don't know what is.
MMS is good, sir. Urodynamics.
MMS is good. I am using urodynamics. MMS. See, Cisco, what you said, not uroflowmetry.
Jocelyn. No, status
uroflowmetry is very good. Status urodynamics is also good. MMS is better than that. But Sanjay Sinha, like people, they may take Labori like that. That's very costly. Video urodynamics is very costly. See, this talk is primarily for the beginners and evolving hospital owners. We are not talking about corporates. We are not talking about above mid-segment hospital, less than mid-segment. Even we are also mid-segment hospitals. So we will talk only about mid-segment hospitals. So anything, Vikram, you wanted to tell? Do you have any idea in the India somehow? Graspers suction, central
locals. All locals.
All locals. Whatever you person repairs, you take that. They are all good. Graspers are also RK Medical.
Sir, I think we have not talked about the digital nephroscopes.
Yeah, we told na. If one company comes with all digital, we have to convert into that.
I think at this juncture, we have to mention about Kaushik sir's digital nephroscope, which is suction. I remember the Italian surgeon who came for our workshop asked for that specifically. He wanted to take it back home.
Yes. In fact, Kaushik's suction is also very good. He should come out with all digital to compete with the Biorad.
Yes.
Otherwise, he cannot compete. I told him they will come. Being urologist, who should applaud.
Exactly.
These products are also not bad, very good. I have used suction. Now, any comment on OT lights? We are only 2 minutes time.
OT table and OT lights, again, local servicing is very important. I have got Stan.
From Chennai.
From Coimbatore.
I also heard somebody from Coimbatore, very good. When I went to Ramlingam Sir Hospital, it was very good.
Must be Stan.
This message is very important. You write Stan. Palakkad Surgicals also, people said very good.
It's also very good, but my only complaint about them is they don't come for servicing that well. The Palakkad Surgicals, that is the only issue.
It should be nearby. So I think Stan, OT lights and OT table are very good to my knowledge.
For my comfort level, because they come for servicing, because they are close to my place.
I take from Hyderabad one local person, very low cost. For 15 years, I am using 2 lakhs CM based table. No problem at all. Even 2.2 lakhs digital. I mean, up and down, it will go with a button. There is no problem. So we have to conclude at one point. We have only 1 minute time. Dear friends, everything is unbiased. Please do not mind. Some may comment on this also. Companies tomorrow may come and say that we are not worried. Our soul is talking in this talk. We both shared our experience. People have shared very good that this session is recorded. This session will be put in YouTube link today within 5 minutes in ASU. Once again, I am requesting, become the ASU member. It is only 6,000 rupees. If you have any respect to us, particularly to me, if I am taking this thing, this month is membership month, 6,000 rupees you pay, become lifetime member. No other world society will give so low. I'm not saying 6,000 is cheap. I'm saying it is affordable. Please do that. Second thing is Sri Lanka trip we are doing. Already 40 registrations have been done. We may give some gifts also. Once we cross 40, I will bargain. It is only 55,000 rupees. There is no visa. All you have to do is 50,000, take the suitcase and come, including breakfast, lunch, dinner, everything is included. Visa is not there. Passport is only required. 6 months validity should be there. You get it in 10 days. December 4th, 5th, 6th, 7th. Other zonal members, it is allowed, provided at least you become associate member by paying 6,000. Imagine, other than South Zone, if somebody wants to come, pay another 6,000 to South Zone, come with 55,000. We accept you as our friend. We'll enjoy. There is nothing. Entire urology is one community. So with this, exactly 7:30, I am closing. The Chengalvarayan sir is in front of me. Sir, please at least give the concluding remarks. It will be encouraging to us. Thank you, sir.
Thank you very much. Thank you very much.
1 minute, sir. Membership link. I am telling you, South Zone. There is a website. You go there. Every detail is there. You just write South Zone Urology website link. I am sharing again and again. Somebody has written membership link. Sadhan Kumar. You call me. I will give you all the details. Even one member in this webinar becomes 6,000 paid. I will be very happy. Sir, Chengalvarayan sir, President sir.
Yeah, thank you very much. Thank you very much, Chandra, Mohan sir and Vikram Sreedharan. I was listening to our entire conversation regarding how to use these materials. I think when we were postgraduates or when we finished our postgraduate long back, the discussions would have been simply on what kind of a scope, Olympus scope, or you going for a Karl Storz, or you're going for a Wolf, a side channel, you're going to front viewing. But nowadays we do understand things have completely changed, and people now have to concentrate more on laser as well as these thulium lasers and holmium lasers, as well as all the RIRS and endoscopic things, much more than the open surgeries and just to the simple endoscopes. With the discussions which came up today from both of you, we do understand how much of interest you people have in these things, and how much of people understood, and so much of comments came and so much of chats came. I think you would definitely need almost one full day to answer the questions which have been coming up. And the number of people inside the session, nearly 170, 175 of them, shows that how much of them is really interested. So thank you very much, Dr. Vikram Sreedharan sir, for giving a nice
Thank you,
talk. And thank you, Dr. Chandra Mohan, for selecting a wonderful topic which interested so many people. Thank you very much.
Thank you.
Thank you, sir. Thanks for the opportunity.
Thank you,
Thank you,
Vikram.
sir.
Highly appreciated. Thank you,
Thank you, sir.
President sir, for giving a freedom to me to conduct this type of webinars. I really appreciate your encouragement to us, sir. Our council also. Thank you very much, everybody. Feel
Thank you,
free,
sir.
please become a member of ASU. You will get all the benefits. Innumerable number of benefits will be there. Sooner our president sir is coming with ASU legal cell. That provided you become member, you will not get advantage. Any problem if you face in your day-to-day life, you can contact council through proper channel. That proper channel is the aim of present council. Please do not miss membership. This month become members. We are going to conduct how to protect legal aspects also one webinar. These things are less covered, so we will try to do